And if you could describe what would you say is a misunderstanding about the work that you're doing within your community that you are often having to re-explain?
One of the big things is like who can be a foster parent. A lot of people think that they have to be married, they have to own a home, they have to have a large home and all these things and you don't. You can be a single individual. We accept same-sex relationships. We don't discriminate about, who you love or your religion or where you live. You can be in an apartment, you can be younger, you can be older. We just want people that are willing to commit to help young people in one of the toughest moments of their lives. And we'll provide you all the training and all the support that you need to be successful.
Thank you for that context. I think it's really important, and especially with the work that you are doing, and it's so supply constrained, right? There's not enough foster parents, so I
Right.
think it's incredible that you're not discriminating because in putting up extra barriers on something where we're really trying to do our best to reduce barriers is kind of anti-mission, I would say.
Absolutely. Absolutely.
And this has been a challenging year, for nonprofits across the space. What would you say, within your community and within your organization are a few challenges that y'all have been facing and conquering this year?
Yeah. So a lot of it has to do, obviously, with funding and the lack of funding. A lot of the federal resources have been cut or decreased, and that affects everybody. So, fortunately, we haven't had too many federal funding sources decrease our work. Most of our state and federal money goes to our adoption programs. However, when other nonprofits are facing those issues and we're all competing for the same grants, well, the grants now want to prioritize, likely, understandably so, those that are facing those federal cuts, which means we are no longer in competition for the funds that we were able to get last year. So it's a trickle
Mm,
down ripple effect of really having those funds. And those funds are important because we can use those usually in a more flexible manner than, say, like a Medicaid dollar or a dollar that's very restricted from a
where only
grant.
10% of that's going to go to overhead with those restricted ones. Yep.
Exactly, right. So we really count on people to invest in our mission through donations or other ways they can volunteer and help us to make sure that we're able to continue to do the important work of helping foster kids and helping individuals with a disability throughout any kind of federal or state climate.
There's this difficult balance during this kind of time of chaos where you want to communicate trustworthiness and stability within the organization while also communicating the need for both the community and the organization to your donors. Whenever you're talking to a donor and having these conversations, how are you striking that balance to where you're not kind of scaring them away? Everything is going down unless you give
Right.
me, support versus, hey, there are some real challenges we're facing and you can make an impact by, working and supporting with us.
Yeah, we really emphasize the stability of our staff and our leadership, and our mission doesn't change, right? What we're doing doesn't change. And so it's like, trust us to continue our mission because the people we are serving, they're hit the hardest. We may be facing some things, organizations may be facing some things, but the individuals who we are serving, are facing triple what we're enduring. The young adults who are leaving the foster care system. 70% of the women who leave foster care are pregnant by the time they're 21. There are some staggering statistics that we are fighting every day, to make sure that we are giving young adults a trajectory that is positive. And the people that we're serving are going to be in your community. So if we can help them be as productive as possible, then your neighbor is productive as possible. Your kids' friends are healthy and their mental health is stable. So it comes around like this is all our community. We are not separate from the people who help us. We're interwoven, right, into all of the communities that we're serving.